The Northwestern Neuro-Oncology Tumor Board, or tumor boards plural, are a set of intense venues in which the care of patients is discussed by a variety of different subspecialists, ranging from neurosurgeons, radiation oncologists, neuropathologists, neuroradiologists, and of course, neuro-oncologists. There is a really practical integration of the discussion on imaging, including advanced imaging modalities that have been performed here or elsewhere, as well as molecular neuropathology, oftentimes with a variety of interesting studies such as extensive next-generation sequencing and DNA methylation profiling performed here in-house. One of the, I think, important elements that we discuss is the role of clinical trials. And the clinical trial platform that we have here at the Malnati Brain Tumor Institute involves systemic therapies, radiation therapy, and surgical trials. I think Neuro-Oncology Tumor Board is a venue in which a number of highly experienced physicians can collaborate, can question each other, can feel comfortable questioning each other's perspectives, can have a strong defense for why Vision A is better than Vision B, and then ideally that can lead to the highest quality patient care. I had discussed a case earlier today that involved a patient with metastatic melanoma who'd been treated with a number of prior lines of systemic therapy and then was recently found to have brain metastases. And this was a patient who is young, who has an excellent performance status, and should be able to tolerate whatever we treat with. And so the decision-making was fairly complex and involved questions about optimal timing of radiation, what is the optimal systemic therapy, heavily focusing on targeted therapies as well as immunotherapeutic approaches. And then thinking about how we tie all this in with our colleagues in the melanoma clinic. As a neuro-oncologist, we care for patients who have a very serious disease or diseases. And even something as simple as having the reassurance of your peers that you're doing the right thing has tremendous value. It's just good to be able to present something and then have everybody say, yes, I would do the exact same thing that you had planned. At the Malnati Brain Tumor Institute, we have thought leaders in the field, and it is exciting to be able to sit in the same room as the people who have defined and are defining the field and say, hey, how do we best care for this person? How do we push things forward? This is what the standard is right now. What will be the standard 5 years from now?